if you look at the health benefits that come with this exercise, with this spiritual exercise, it is as though that is the main reason why Allah subhanahu wa ta'ala asked his servants to fast. So usually I say, it is only a bonus that comes with the blessings that we are all anticipating from performing this exercise. The health benefits alone are enormous. And even non-Muslims who have read and have studied the benefits of fasting during Ramadan, they make the effort to follow us in fasting. And all that they need is to be able to harness the health benefits that come with it. But if we, the Muslims, unto whom Allah has given this instruction for us to fast, it also means that we should be the first to search for the benefits, health, in terms of health, that this spiritual activity comes with. And we probably will not be able to understand until we have such engagement. Let me indicate that if you go ahead and do your fasting, perform your Ramadan, probably without following any of the recommendations that we may give at the end of this presentation, your fasting will still be valid in terms of its spirituality. But we want us to get the additional benefit that I refer to as the bonus. We want to get the maximum of it. And so we find it necessary to engage in this conversation where we can explain the health benefit that also comes with this spiritual activity. Now we have two terms in our topic: fasting and feasting. We have to understand when we say fasting medically, what does it mean? Medically, fasting is a voluntarily not eating food for varying length of time. So if you decide not to eat food or to abstain from food and water for a specific period of time, that is referred to as fasting. And in medicine, usually when you abstain from food for about 8 hours to 12 hours, you have entered the fasting state. And it is the wisdom behind when you go to the hospital and they want to check your sugar levels, they want to check your lipid profile, they tell you when you wake up in the morning, don't eat anything until your samples are taken. That is because the assumption is that even if you ate your last meal 7 p.m. the previous night, by 7 a.m., that will be 12 hours. You have entered the fasting state. And that is why we call it fasting blood sugar, fasting lipid profile. That is the essence. That is in terms of medicine. It is a complete abstinence from food and drink between dawn and dusk. And I am now marrying that with our concept of fasting, the Islamic way of fasting. Now, there are types of fasting in terms, when you are looking at it in terms of health. Fasting can be categorized based on the period, how long you fast. Fasting can also be categorized based on what you are abstaining from. Based on period, we have what we call intermittent fasting, and then we have continuous fasting. Intermittent fasting is when you alternate periods of eating and also not eating. That is intermittent fasting. And Ramadan is a good example of what we call intermittent fasting, because we abstain from food for about 14 to 16 hours, and then we have food for about 8 hours, 9 hours, in that manner for 29 or 30 days. So that is a perfect example of what we refer to as intermittent fasting. Now we have what we call also the continuous fasting. Continuous fasting is when somebody decides to abstain from food for a week, for 2 weeks, for 3 weeks, sometimes up to a month. That is continuous fasting. And later we'll look at the implication of both types of fasting. Then fasting can also be categorized based on what is it that you are abstaining from, the restrictions. Medically, we have two. We have what we call the full fast. And then we have the partial fasting. The full fasting is when you decide to abstain from food for a period of time. It is called full fasting. But you don't abstain from water. You abstain from anything that is ingestible or that you can eat, that you can consume, but water. You are undertaking full fast in terms of medicine or health. Then we have what we call the partial fast. Partial fasting, you can say, I am fasting from eating cereals. You won't eat rice. You won't eat anything from maize. So that is fasting. Or you are fasting from all kinds of foods, but fruits and vegetables for a period of time. That is also another type of fasting. And in terms of medicine, all these type of fastings have their purpose and when they use them, especially in terms of treatment. And then I add the third one, which is the Ramadan fasting, where you abstain from food, water, and even other social activities. You don't consume anything at all, not even water. So that is why I leave it in its own category. Otherwise, that also qualifies as full fasting. But in terms of health, usually water is allowed even under full fasting. So these are the different types of fasting. And when you come to health, how it is used, especially the partial fasting, sometimes you have an interest in boosting the immune system of a patient to be able to fight a particular infection. We know the body's immune system, which we can refer to as the body's security or soldiers or the police. As we all sit in here, germs and other agents, disease-causing agents, are making the effort to attack our system. Only God knows how many pathogens that you have inhaled on your way here. As we are seated here, only God knows what is it that our system is fighting that we have no idea. You only know that you are sick or the immune system is under attack when you are sick. It means that the immune system is not able to fight the pathogen or the disease-causing agent. Otherwise, constantly, the body's immune system is at work. It's always undergoing some kind of surveillance to identify surveillance so that it can fight it. Now, we have certain sicknesses, conditions, such as cancer, such as generalized, we call it lupus, generalized body inflammation. You need to boost the patient's body's immune system, prepare the soldiers to be able to withstand it. Sometimes they undergo this kind of fasting. You give the patient nothing but only fruit and vegetables so that you can strengthen the immune system. You are loading the body with nutrients so that you empower the immune system to be able to fight the disease. So that is when and how it is used medically. Now, the second term that we have is feasting. What is feasting? Feasting is a social activity that involves special meals or celebrations after or often in memory of a religious event or person. So usually during Eid al-Fitr, after undertaking this spiritual exercise successfully, we decide to do some celebration. Eid al-Adha, we slaughter our rams and we celebrate in commemoration. That is feasting. But during Ramadan, what we call iftar is not feasting. We only refer to it as a meal, and we'll get to know why. Even though a lot of us have turned that into a feast. So they feast 29 days or 30 days. And we'll look at the implications of that. Feasting is characterized by its abundance of food, and it is an opportunity for people to share love and to share food with people who don't have. That is the characteristic feature of feasting. Feasting may be defined as a form of ritual activity centered on the communal consumption of food. So if you look at the meaning of feasting, it is not what we want you to do when you are observing Ramadan or fasting. But what you have to do is to take a meal, iftar and also sahur. So there are some physiological changes during fasting, and usually that is the basis for our claim that fasting or intermittent fasting is beneficial to our health. Now, when you fast, what happens? You get up early in the morning and have what we call the sahur or pre-dawn meal. And the whole day, you are not supposed to have anything. You are not supposed to eat anything. Usually, at least, an individual will eat 3 meals in a day. But during this period, at least you skip lunch or you skip one of the meals. So the body will make use of what is in the blood, is sugar. Now, any food that you eat is converted to sugar. So you don't have to necessarily consume sugar before you have sugar into your blood. The cocoa that we take, the kenke that we take, the rice that we take is metabolized and broken down into sugar. Now, all of these are converted to sugar. Once they are converted into sugar, they are absorbed into the bloodstream. And that is the energy, that is the petrol for you to undertake your activities. So the body cells, and our body, what you see is cells, picks the sugar and then make energy out of it. And that is how you're able to undertake your activity. That is how you're able to sit here and listen to me. That is what is enabling me to be able to talk and for you to listen and process what I'm even telling you. Now, once this sugar is used up, because you have not eaten lunch, the body will enter what we call ketosis. It will finish utilization of the sugar in your blood. Then we have what we call glycogen. Glycogen is the excess sugar that is stored in the liver and muscle. So once the sugar in the blood is used up, the next point is the glycogen. So it will break it down to glucose, and then the body will use it. Once you are done using the glycogen, the body still needs energy to support you to carry out your daily routines, your daily movement, your daily activities. So it resorts to what we call the fat stores. It will now break down your body fat and be able to make energy from that for you. That is the state when we call ketosis. Once you enter ketosis, insulin levels will drop because insulin is a hormone that is produced by the pancreas in the body. Now, this is the role that the insulin performs. Insulin helps the body cells to be able to pick up the sugar and then make use of it. So once the sugar levels come down, it means that there is no need for insulin to be released. So there will be low levels of insulin. Now, we have insulin and glucagon. Once one is low, the other one will be high. So glucagon levels will also go up. And that is what facilitates the breakdown of body fat. Now, this breakdown of body fat is not only the fat that you store in the body, but also the cholesterol that you accumulate in your blood vessels. It breaks it down so that it can convert it to energy for you to use to carry out your daily activities. Then we have the next stage is hormonal changes. We have what we call human growth hormones and other hormones that are released when sugar levels are low. Now, these human growth hormones, they help in reparation of your worn out cells, cells that are weak, cells that are broken down. And then it revitalizes the system. And that is why after breaking your fast, you feel that freshness. You feel that the body is kind of revamping itself in terms of health. This is what happens physiologically when you fast. Then the next stage is what we call autophagy. Autophagy is when the body cells craving for energy now will pick up the broken down cells and convert it into energy and consume them. So it will leave the healthy ones, but the broken down ones, the dead cells, the debris, it will consume them, it will engulf them and make use of them. And by so, eliminating this kind of broken down cells that usually accumulates to cause some level of stress within your body. So it also helps the body to freshen up itself. Then there is reduction in basal metabolic rates. Now, basal metabolic rates is the activities that the system performs usually when you are at rest. As we are seated, you are not doing anything. The brain is working. The heart is working. You are sweating. The GIT system is working. Digestive system is working. So that is the basal metabolic rate. And it consumes a lot of energy. So fasting helps that to slow down because generally the system, the GIT system, its activity will drop because you have not eaten your lunch. So it helps that to slow down. And the energy that will be saved from that is used to repair the system, especially the GIT, the gastrointestinal tract, your stomach. And if you take the stomach, it is a place where you can find a lot of disease conditions. So usually, it is during this stage that it takes a break to repair itself. So even people who have gastric conditions, such as ulcer and all that, once your doctor clears you that you can fast, it is something that is even going to help you to get some healing once you're able to participate in fasting. Only that you have to do that very well in consultation with your doctor. So there is improved insulin sensitivity. Now, insulin sensitivity is a problem of diabetes. We have type 1 diabetes and we have type 2 diabetes. Type 1 diabetes, you are not able to produce insulin. The pancreas is not able to produce insulin. And we say it is the insulin that will help the body cells to be able to pick the sugar and break it down into energy. So in type 1 diabetes, the body system is not able to produce insulin at all. But type 2 diabetes, you may have the insulin, the body cells are there, yet there is no communication. So the body is not able to pick the sugar and make use of it. So you will see that there is excess sugar in the body, yet the system is craving for energy because it is not able to detect it. So you check your blood levels and you see that sugar levels are so high, yet you are feeling hungry because you have a lot, but you are still hungry because the system simply is not able to work with it. And usually how I explain that for people to understand, you see, when you have a piece of paper that you want to paste on a wall or any platform, you apply glue on the back, so it allows it to be able to stick. So that is the role that this insulin plays. You have the body cells. The insulin helps the body cells to be able to pick up the sugar. So this situation, you have the glue, you have the paper, you have the wall, but there is no communication. You apply the glue, but it doesn't stick on the paper. So meaning you can't even put it on the wall. In type 2 diabetes, often that is the case. Now when you fast, the cells now crave for energy, and they are forced to become sensitive to the insulin, and they are able to pick up the sugar. And that helps with the management of type 2 diabetes. A takbir. Then we have the final physiological change that happened, is cellular repair and regeneration. This is the period when the body seizes the opportunity to repair itself, the worn out tissues, the broken down tissues. It is able to repair itself and make you feel healthy and revitalized. So there are a lot of health benefits that come with fasting, and especially Ramadan fasting. And a lot of research. There is a repletion of research in this area. But what is interesting, it is not even the Muslims that are conducting this research. You go into the literature, and a lot of the papers, a lot of the articles that you find are authored by non-Muslims. But they can't hide the truth, but to tell us the benefits. And I dare tell you, there is no part of the body that fasting, Ramadan fasting, doesn't impact positively as far as our health is concerned. And we'll come and look at it one by one. And I look at this, and it is as though it is the main reason why Allah has instructed us to observe this blessed month of Ramadan. Indeed, Allah is the source of all goodness, and He is all-knowing. So let me take you through a few, we can't mention all, of the health benefits of Ramadan fasting, because our interest is to see how do we practice our dietary behavior so that we can harness the full benefits of this spiritual month. So we need to know some of the benefits in terms of our health that we stand to gain if we do and do it well. And like I'm saying, nobody should make the mistake to change the intention that we are fasting because we want to enhance our health. We are fasting because it is an obligation upon us to fast. I think that suffices. However, all these other things that we are coming to mention is a bonus that comes with it. The blessings, the spiritual blessings of it, the imams will tell us. But I'm here to share with you the health benefits that we all stand to gain once we do it very well. The first one, fasting helps us to be able to manage our weight. Today, weight gain is a common problem, and it is a bigger problem because it is an underlying cause or factor for most, if not all, the non-communicable diseases that you can think of. Once you gain weight and you continue to gain weight uncontrollably, you are exposed to diabetes, you are exposed to hypertension, you are exposed to cancer, and all the other non-communicable diseases, especially the heart-related conditions that we can think of. So fasting helps us to be able to reduce in weight. Now, the food that we eat is what is enabling us to gain the weight that we are gaining. So you eat in the morning, you eat in the afternoon, and then you eat in the evening, 3 times. So, and we are supposed to make use of it. Usually or often, because we are experiencing dietary transition, and what I mean by that is, in Africa and also Ghana, we are living our nutritious indigenous food and now go in for the foreign foods that are characterized with high risk of all the conditions that you can think of. So we are doing ourselves a great harm. We are leaving behind our own food, our local food that are so beneficial as far as our health is concerned, and now going for the greasy and junk food. And that is what we have all developed taste for. And it is amazing how much love we have developed for these foods that are killing us. So fasting helps us to be able to cut down our energy intake. So imagine if you, in a day, you're supposed to consume 2,000 kilocalories. So divide that into 3. And one of it is off. And sometimes there are other activities, dietary, in terms of our dietary behavior, that we don't even count when we are talking about what we consume. And that is really sometimes where the benefit emanates. On a normal day, you have your breakfast. Before lunch, you will see some Coke, you will drink some Coke, some yogurt is passing, you buy it. But when they ask, usually you don't count those ones. I ate porridge in the morning, in the afternoon I ate kenkey or rice. But you forget about those little things. And that is actually the source of the energy. So imagine during the day, all these ones you are not doing, plus the main lunch that you are skipping. So that tells you how much energy you are cutting off. And that translates into weight loss. So research has shown that on average, even though sometimes we do that unawares, we lose about 2 to 3 kilograms by the end of this blessed month of fasting. That is the average. And even those who are conscious about it, it is even more. Later I will tell you how the results that I have experimented that on myself, and I'll share with you the results that I've seen. And it is amazing. Even sometimes the medication that we consume, we take to be able to get this change is not able to help us that far. But fasting is able to do that once you do it and do it very well. So weight is one way that fasting is able to help us manage our weight or reduce our weight. Now, all of us, we can decide from today to go and stand on the weight. Take note of our weight and be conscious of what we consume during this period. At the end of the month, check your weight and see how much weight you will lose. And listen to your body, your healthiness. You will know that actually you have improved in health. You can feel it. And that is the benefit of this blessed month of Ramadan. Fasting also helps us to manage our blood sugar levels, the glucose. We have already indicated that it is the food that we consume that is broken down into glucose for the body to make use of it. So it means that the quantity of food that you consume influence how much sugar you put into the system. So if you're able to reduce the food that you consume, it means that you are in a way controlling the sugar levels that enters the blood. And naturally, that is already helping you to control your sugar levels. That is one. Second, when you are fasting, I said the body craves for sugar. So it doesn't leave any spare sugar, any sugar in the blood. It will try and make use of it. Even in a situation, like I mentioned earlier, type 2 diabetes, when there is insulin insensitivity, fasting helps to improve the sensitivity of body cells to insulin. And that helps with the management of blood sugar. And I tell you, when I was practicing at the University of Ghana Hospital, in fact, my patients who were Muslims, during Ramadan was when I used to see the greatest change in terms of the outcome when it comes to blood sugar. Because I take advantage of the period, plus the dietary restrictions, and it is perfect. So even if you have diabetes, depending on the level of severity, you can be guided to fast, and that will even help you more with the management of this condition. The third one is hypertension, what we call high blood pressure. Now, hypertension is a situation where the pressure with which the heart pumps is higher than normal. So if you make a fist, that is about the size of your heart. Each one of us, if you make a fist, that is about the size of your heart. Now imagine this size of the heart is pumping blood, distributing oxygen, distributing nutrients that you eat and get from the food to all parts of the body, to your head, your brains, and down to your toes. This piece of flesh. Now, when there is any slight blockage in the blood vessels, it impacts the pressure with which the heart will have to pump. And usually, I try to bring it down. If you have a drainage, or even the hose that we use to pump water, if you compress it, you will realize that the pressure will become low. And to be able to get the same amount of water to pass through that point, unless you increase the pressure from the source, before the same amount of water can push through. And that's exactly what happened. So when there is any problem anywhere in the blood vessels, it impacts the pressure that the heart will have to pump to be able to get the same amount of blood, the same amount of energy, the same amount of oxygen to other parts of the body. And that is what we call hypertension. So once there is a protracted happening of it without being controlled, then you develop a condition called hypertension. Usually we use numbers. We say 120/80. So we have from 120 up to 140. Once you go beyond 140 for the systolic, the number on top, you have hypertension. Once you go beyond 90, the number below, you have hypertension. So a variation beyond 140 or 90 will mean that you have hypertension. You don't have to be 140/90 before. Any of it, once you go beyond the threshold, you are qualified to be classified as someone with hypertension. During fasting, we have already mentioned how fasting helps the blood vessels to get cleared, because the cholesterol that accumulates in the blood vessels will be used up. That is one. During fasting, in terms of diet, one nutrient that implicates blood pressure a lot is sodium, salt. During fasting and salt, we consume it from food. Now you have skipped your lunch. So meaning the salt that you have consumed from lunch already is gone. And that is helping you with salt intake. Number two, the small little things that we indulge in during the day. You buy biscuit, you buy plantain chips, you buy some this, that, they all contain some salts, sodium, and they all add to the quantity or the amount of sodium that enters into the blood. And that have a great influence on your blood pressure. So once you are fasting, it means that the salt that you will have gotten from lunch, that is off. And that helps to a very great deal with management of blood pressure. So fasting alone helps lower blood pressure if it is done well. Fasting also improves lipid profile. Now, lipid profile is simply the parameters in your blood in terms of the lipids. So we have what we call cholesterol, we have HDL, high-density lipoprotein, we have LDL, low-density lipoprotein. Now, these are total cholesterol, triglycerides. These are all components of the lipid profile. It gives everything about the lipid profile in your blood. And fasting have positive effect on each and every one of these parameters. Now, if you take the HDL, usually that is what we call the good cholesterol. The HDL, why is it called the good cholesterol? Because it mobilizes excess cholesterol in the blood vessels and take it into the tissues for utilization, for it to be metabolized for other purposes. But the LDL, low density lipoprotein, usually that's what we call the bad cholesterol. It mobilizes cholesterol from other parts of the body and carry it into the blood vessels, causing a plague, blockage in the blood vessel. And when that happens, that is when you have lipid problems in the blood, in your system. And that's what usually we call it dyslipidemia. And it is bad. Sometimes there is no sign. It won't tell you that, oh, I have high levels of cholesterol in the blood. The problem is that it accumulates in the blood, and once it causes a blockage in the blood vessels, at some point, the pressure, the heart will have to pump with a very high pressure. It will dislodge it. It will break it off and carry it to a place where we have what we call blood capillaries. The blood vessels are tiny. Now, this debris or cholesterol that is broken and transported to that point, it is not able to pass through, so it causes a blockage. Now, if it happened to the brains, that is when you get what we call stroke. If it went to the kidney, you have kidney problems. If it went to the liver, you have liver problems. So that is the complication that we get from cholesterol. Otherwise, cholesterol itself really is not a problem. But these complications that it can present to us is why it is a problem. Then fasting improves treatments of cancers, generalized body inflammation, what we call lupus or arthritis. And I have already mentioned that fasting is one of the ways that medically it is used to treat some of these conditions. If you are fasting, it helps you. If you have cancer, it helps with the management. If you are fasting, if you have what we call arthritis, usually pains at the joints, it is able to help because fasting lowers what we call cytokines, the inflammatory parameters or some indicators in the blood. And we've seen the implication of fasting even on our immune system. So during fasting, it helps us to be able to manage some of these chronic conditions. Then I have already mentioned the human growth hormone that helps to repair cells that are broken down. And that is how fasting improves longevity. It helps one to live longer. So anybody who doesn't eat too much lives longer. And if you look at the whole world, there is one place where they have the highest or the longest lifespan, Japan. And there's a town called Okinawa. And there was a research conducted, and it revealed that they have a principle. Anytime there is a bowl of food in front of them, they leave at least 1/3. So they don't consume all of it. It's a principle. So that helped them to cut down their intake. And research is pointing to the fact that it is contributing to their longevity because they are cutting down the energy that they consume. But when you consume energy, you eat food and you don't use it for anything, it is converted to body fat. And that is when you continue to grow big, and then the other conditions will now also come in. Fasting helps in the treatment of digestive disorders, such as ulcers. So once you have ulcer, usually people try to avoid fasting. Number one, I will say consult your doctor. Find out whether it is possible for you to fast. Sometimes, unfortunately, some of our medics, they have no idea the benefits of Ramadan fasting. And also, they have no idea the implication of Ramadan fasting on these conditions. So they just tell our patients, you can't fast because you have it. But a lot of people who have ulcers, their ulcers is such that they are able to fast, and a number of them are able to fast. Only that you have to be in constant touch with your doctor. Take that clearance from your doctor. Let him know that you are going to undertake this spiritual activity so that they can give you close monitoring. Or sometimes they may modify your medication a bit to allow you to be able to do that. Once you're able to do it, I can tell you that your situation will be better once you complete this spiritual exercise. Fasting also helps the body to flush out toxins. Now, see what happens. The system, how Allah has created our body. Now, when you consume food, the digestive system, it is very delicate, but very sophisticated. It is very soft, but the kind of work that it does, my professor told me that if we could push our hand down our throat, the digestive system will digest it. That is how powerful it is. Yet we have our own tissues, it is not doing anything to it. It is able to identify what it should work on, what it should digest. So that is what this digestive system is doing the whole year. Every day. You eat in the morning, you eat in the afternoon, you eat. Some people even till they go to bed, they are still eating. So the digestive system is working constantly all year round. It is only this time that Allah has ordained that, allow it this break so that it can also repair itself and get some rest. And indeed, science has proven that during this period, the digestive tract is able to repair itself. The energy that it uses to break down the food that we eat, it is able to channel it into repairing itself. So you come out at the end of the period having a better digestive system. Now, when you eat food, like I said, the digestive system will break it down into sugar and then, or amino acid, if it is protein. Then it is absorbed into circulation. And see what happens. When the nutrients are absorbed from the digestive tract, it is taken first to the liver for detoxification. Now the liver is able to tell this is harmful to the body, it takes it out. This is good for the body, it allows it to pass. So it will go there for detoxification before the heart will pump the one that is purified through the whole system before the system is utilized. And you look at this and say, this is by chance. How can this be by chance if someone has not planned this? So it is never true that this could be by chance. The way the system are working. And then you have the pancreas, you have the kidneys. The job that each of it is playing, it is more than an industry. And the level of coordination, no human being can do it. And the control, the measures, everything is within range. Your sugar is within range. Your blood pressure is within range. If you take anything into the system will find its way to adjust it such that it won't harm the body. We call it homeostasis. It will try to make it such that it will balance it. If it is hot, it will make it cooler. If it is too chilled, it will improve upon the temperature so that it doesn't harm the system. So this is what the system does. So the liver performs this detoxification. So during this period, now the deaths, the pathogens, the substances that otherwise will have damaged the system that the liver is able to take out, this is the time that the liver will also take it out, flush it out, because it is resting. It is not undertaking any vigorous exercise, especially during the day. So it is able to rest, and these other substances, it is able to get rid of them. So that is what happens and how the detoxification helps. Improvement in the kidneys. So the kidneys also are able to rest. Usually we overindulge, especially now, the amount of meat that we consume. You will see a bowl of food that an individual is going to eat, and all that you see on top is meat. You will see fish, you will see meat, you will see wele, some people you even see egg. One person, one sitting, one meal. So now, but we adults, once you hit 20 years, 25 years, you have finished growing, unfortunately. If you are hoping to grow, you won't grow anymore. So it means that the protein that you are consuming, all that you need is what will help you to repair the system. The activities that we do, the working and all that, the cells break down. So you need protein to be able to repair them. And as an adult, if you take a matchbox size at every meal, you need a maximum of 3. So matchbox size, time 3 of it breakfast, 3 of it lunch, 3 of it supper. That is it, you are done. You don't need any more. But you see an individual, one meal, he has already covered for the whole day. And he's waiting for lunch, waiting for supper. So, and protein is not stored in the body. Unlike sugar, unlike glucose, that will be converted to glycogen and subsequently to body fat. Protein, no. Once the body takes what it needs, what it wants, the excess is excreted through urine. And that is why you see the color of your urine. So during this time, you cut down the intake of protein and the kidneys are able to rest. Meaning the load that you give the kidneys is reduced and it is also able to rest and also repair itself and be able to flush out the toxins and the dirt that it has accumulated within. There are a lot of benefits, even when it comes to our social, psychological aspect of our health. Now, science has proven that anything that you can abstain from for a month, you can abstain from it forever. So it means that if you really want to stop smoking, fasting period can help you to stop that. If you want to stop drinking alcohol, fasting can help you to be able to stop that. If you want to stop womanizing, fasting is a period that can help you. And there are some people, they don't have control when it comes to their satiation in terms of their hunger. Any little thing irritates them because they have not eaten. But this period, it trains us. You know that the whole day you are not going to eat. So you train yourself and people improve in managing that aspect of their health. So it is very, very important. Even when it comes to our mothers, we often say, and we look at the exemptions. Pregnant women are exempted from fasting. Breastfeeding mothers are also exempted from fasting. But even these non-Muslims have even investigated whether there is a change to the breast milk constitution when they fast. And it showed that there is no difference whether they fast or they do not fast. So fasting does not even affect breast milk constitution. And for women who are pregnant and want to fast, usually in the first trimester, you know, pregnancy is 9 months. First trimester, first 3 months. Second trimester, and then the last trimester. First trimester, in terms of nutritional requirement, there is no substantial change. The change is not that big from a normal person and somebody who is pregnant, the first 3 months. So if a woman wants to fast, if she's in her first trimester, she can do it without any problem. Only that some people, especially if the pregnancy is their first time, they have problems, vomiting and all that. If they have those issues, then they can abstain. But if they have no problem at all, there is no problem, they can continue to fast. Because in terms of energy requirement, a pregnant woman is during the second trimester, that energy requirement increased by about 300 kilocalories. So you add about 300 kilocalories to the total caloric requirement that you should have in a day. And then the last trimester, which is the third trimester, about 450 to 500. So that is what is allowed. But then if they still fail, they can fast. There is no problem at all with them. Even women who are seeing their menses, fasting does not even affect them that much. You know, scientists study anything, not necessarily to support the claims of Islam. But they have even realized that even in that state, women can fast without having any problems. However, the caveat is that if you have any issues, if you have any problems, abstinence is the best. Now, who is exempted from fasting? And usually our imams will tell us who is qualified to exempt himself from fasting. The number one is somebody who is sick, a traveler, a pregnant woman, and then a breastfeeding woman. And this is mentioned in the glorious Quran in chapter 2, verse 185. And I quote, "And whoever is ill or on a journey, the same number of days which one did not observe some, which is the fast, must be made up from other days." So it means that if you have some of these conditions, especially if it is a sickness that is not chronic, it is not chronic means that it is not perpetual, it is not continuous. Maybe you are having malaria and you can't fast. You know, malaria is treatable, will be treated and you can fast. So it is not like you having an ulcer that you cannot fast. It's not like you having diabetes, the type of diabetes that you cannot fast. So if it is malaria, if it is a short ailment that can be treated, then once you are well, you can make it up. But sick persons also, because they are sick already, their system, they become vulnerable. So when people are sick, they need more energy to be able to fight the infection. So usually we don't advise that they fast. And then traveler. And I now see the wisdom and even travelers included in the exemption list, because we have what we call motion sickness. There are some people, when they are traveling, they vomit, they have stomach discomfort and all of that. And usually you cannot fast in that situation. So if you feel you have those problems and you will not be able to fast, you are allowed not to fast, and then you make it up some other day. And like I said, breastfeeding women and also pregnant women, if they feel they cannot fast, they are also qualified to be part of the exemption list. Then we also have people of senility, very old people. You know, there are people, they don't even remember whether they have eaten or not. They are so old that they don't remember anything. They are also sometimes exempted. And another verse from the Quran, which reads, "And as for those who can fast with difficulty, they have a choice to either fast or feed a miskin for every day." So these people, once they fail, they will not be able, and of course, I am not a religious scholar, so they will have to probably consult the imams to really get a clearer understanding whether their type will be that they will pay later, they will feed and all that. That interpretation, they will have to contact the imams and the scholars for that. Then we also have intense hunger and thirst. You are in a situation where you don't get food. You are in a situation you don't have water. So it has become obligation upon you because you don't have the choice. So you continue with the fasting, or you can decide not to fast because already you are not getting food. So anytime you get food, then you have it. And also compulsion. Once you are forced to eat or not to eat, you have no choice to say you are going to continue with fasting. Now, let me probably wind up with dietary recommendations for healthy fasting. Number one, make sure that you have 2 meals. You don't have to skip the sahur or the iftar. Both meals are very important. It is important because it gives you the energy to carry out your activities during the day. So you don't have to skip it. So, number 2, do not overeat. Some people say, let me eat because I will not be eating lunch, so let me eat to compensate for lunch. When you do that, you are only, and you realize that when you overconsume, you overindulge during sahur, you become so lazy because the blood flow to the brains will drop. The blood will now have to prioritize what is within the stomach region to be able to move with the digestion. So it drops from the brain and you feel dull, you feel dizzy and all that. So it is not helpful to do that. And there is an admonition in the hadith where the Prophet says that a human being feels no worse vessel than his stomach. It is sufficient for a human being to eat a few mouthfuls to keep his spine straight. But if he must fill it, then 1/3 for food, 1/3 for drinks, and 1/3 for air. So it means that even if you want to overindulge, make sure that you leave space for water, make sure that you will be breathing. You don't have to eat to the extent that you can't breathe. That is not helpful during this period. Avoid fasting on an empty stomach. Some people think it's a mark of masculinity. They are, men. I mean, I have not even eaten, but I'm fasting. No, it doesn't help. That is when you can develop conditions such as ulcer, especially if you don't have appropriate dietary behavior. Identify which food. Some people naturally getting up that early to eat is a problem. So identify at least 1-2 food that helps, so that at least you will get up and eat something. That's why we are advised that at least, even if it is water, it is important. There is blessings in it, and you have to get up and eat something. Meals should come from legumes, nuts, whole grains, unprocessed maize, millets, oats, wheat, brown rice. So the food that we eat, we don't have to vary it too much. We have to make sure that it is not greasy, it is not oily, it is not shining, and all that. That is helpful. You don't have to sieve the food that we eat to remove what we call the dufu. That is the roughage. That is what is containing some of the micronutrients, and that is the fiber. So you don't have to take it out. That will not be helpful. Limit the intake of refined foods, such as sweetened beverages, carbonated drinks, such as caffeine and all that. And caffeine will make you urinate a lot, losing a lot of water. Meanwhile, during the day, you will not be having any water. So we don't want you to lose the little water that is within your system. Cut down your fat intake. Include a lot of vegetables and fruit during sahur and also when you break your fast. Meals should be balanced, so you don't have to be eating one way every day. Cocoa, porridge for sahur, porridge when they break your fast. No, try to balance it. Even if you are a porridge person, we have wheat, we have oat, we have Tom Brown, we have rice water and all that. You can vary it. That is when you get the full benefit. Drink as much as water is very important. At least 4-5 sachets of water in a day is very important. At least 2 of it during sahur and even more. And when you get an opportunity, drink more because it is very important. That is what will help the body to be able to flush out the toxins. Avoid or cut down caffeinated drinks and then maintain physical activity level. Some people, when they fast, they will just open the AC on themselves and they don't have anywhere going. That is the period when people are taking leave so that they can rest. It is not helpful. If you want to really have this benefit that we are talking about, you have to be active. There are complications, especially during the first few days of the period. You may experience headache, dehydration, heartburns, some stress, constipation, and all that. But with time, it will adjust. Once you experience it, drink a lot of water. Drinking a lot of water will take care of the headache, dehydration, and even heartburns. So drinking a lot of water during the period is very, very important. And then in conclusion, Ramadan is a blessed month of Islamic calendar that is well noted for its spiritual benefits. However, the health benefits that come with it, which, like I mentioned, I refer to it as bonus for us from Allah, and that alone will make you want to sink yourself into this blessed month of Ramadan. But we can attain maximum health benefits only when we adopt a healthy diet and also healthy behavior during the period. With this, I say Assalamu alaikum wa rahmatullahi wa barakatuh.
Travel for an hour again, but that's why we are introducing this concept. And once a while, we need to even send him to Zongo and our communities. Education on diets and nutrition is very, very important. As you have heard, it is the leading killer in our communities. May Allah help all of us. Our time is finished, but I would allow only 2 questions. Yes, so Imam, Chief Supo Imam Hussein.
Come and give the speaker to me.
I know Chief Supo will pay much attention because he's somebody who takes good care of his food. Yes.
The presentation, subhanAllah, very, very, very educating. I was very, very excited. Full of education. I pray that Allah subhanahu wa ta'ala will continue to raise you high so that you continue to educate the woman. Two issues, Doc. As part of the benefits you mentioned, it has to do with the losing of weight, like me and my brother here. Losing of weight, yes, it's a factor. And you corroborated that with the amount of food that we take. Now, sometimes, as you said, you may lose 2 or 3 kilos at the end of the day. I want to know how best to measure. For example, you normally call something BMI. So I want to know exactly whether, as I am now, I am overweight or I'm not overweight. Probably you may see my brother huge, but probably he's not overweight. So I want that education so that at least if I'm doing the mathematics as you said, probably I will go and stand on the weight. I lost 2 kilos or 3 kilos, but I'm still overweight. Therefore, I have to work further and get to that measure, which I think is important. Point number 2, Doc. Sometimes the food you mentioned, I wanted you to give us a detail or probably look at our local food and tell us, okay, this and this is better for someone. This is also better for iftar. So I would like you to, because you rush at that point, if you can just pinpoint some of the food that we eat, the cocoa and whatever, if you can just look at it for us. And sometimes, some of these food that you mentioned, my experience is that if I take something, maybe some small, I struggle in my tarawih. So sometimes I have to go and eat water and then take it before I am able to start. So these last few days, I've decided even not to take any food at all, unless after tarawih. So this food, I want you to look at it for us. Thank you, Doc.
Maybe we'll take a comment from Haj Salim. Okay,
It's
that's
also
all.
very
Yes, I know very well. So come.
Let me also commend our speaker for a very insightful lecture. Mine is on water, Doc. You mentioned how careful people in Japan are. I've never been to Japan, but at least I was in China. And I realized that if you go to, let's say, a restaurant and eat, unless you specify, the water that will be given to you will be hot water or warm water. Here, some people even break their fast with chilled water. So what I want to find out is there any benefit in taking warm water or hot water after eating? And is there any effect that chilled water has on us? That is what I want.
Let us gather the question.
Okay, so officer. And then Razak should be the last person.
Lord mentioned fasting and feasting. But I only delved into the fasting, so I wanted to know with regard to the feasting. But it says I'm going to feast for the whole 30 days. And I also want to like to know whether what you take during Ramadan has to do with your blood group. If our blood group has anything to do with the kind of food that we eat. Then also during Ramadan, if there's anything that can be done to help us more during those periods. Thank you.
So take the last one from Razak.
Thank you very much. items because of food. One that's how do you coincide that with undertaking rigorous activities such as prayer or walking?
Say that again.
Taking of 3 times much of food. How do you coincide that one with undertaking activities such as prayer or walking?
Okay, so that's one.
Assalamu alaikum. What a wonderful presentation, very insightful. I want to digress a little bit. My concern is about kidney failure. These days, you are listening a lot of prayers away from my office. I recently lost one officer. It's been a common disease. What advice would you give us instead of in terms of what you take to avoid these diseases? Now we can do groundwork. That's my question.
No. The desired BMI. That is where we want everybody to be. Now, 25 to 29.9, we call that overweight. 30 and above, we call that obesity. Now, even the obesity, we have class 1, class 2, class 3 obesity. So that is it. But that is obesity. And each of it have different implications on our health risk, depending on where you belong. So now, how do you tell whether you have weight problem? One, that is one. So it is difficult. Even we, the professionals, I may not be able to look at Imam and say you are overweight until I do the measurement so that I can compute and tell. The other thing that I want to add to that is that there is a problem with that measurement. So now we have what we call body impedance analysis machine, BIA machine. It is able to tell you, because the BMI, it includes your muscle mass, it includes your body fat, every other component of your body is there. The BMI is a crude way. It's not able to tell you, okay, now you are overweight. Is it muscle mass that is contributing to the weight or body fat? If it is muscle mass, it's not a problem. For example, you take the weight lifters, see their body. They are overweight and they are obese, but that is not a problem because it is muscle. It is not fat. It is only when it is accumulation of fat that is what is associated with disease. BIA calculation is not able to tell you that. It is the body impedance analysis machine. Once you stand on it, it will tell you, okay, this percentage is muscle, this percentage is fat, and that is able to tell you, yes, in terms of in-depth, what the problem is. So now that is what we use now for that. And what is better for sahur? Because you are going to eat once and it should take you throughout the day, the recommendation is that, so I won't say go and eat kenke, I won't say go and eat maybe TZ, but usually I ask, what is it that you eat? For example, if you are taking tea, you are used to taking tea, I will advise that instead of going for Lipton, which has caffeine, or caffeinated, any caffeinated tea, I would say go and look for decaffeinated tea or green tea, because those ones, they don't have caffeine. The caffeine they have diuretic properties, so they force the heart to compress and even the blood vessels, and that makes you lose a lot of urine. And during the day, you don't have opportunity to take any water, so you don't have to take something that will make you lose water. So you get it. Now, if you are taking it with bread, you can add some milk to get some protein. You can add some egg. The egg, you can decide to boil it, not necessarily fry it, because you want to make it healthy. You want to minimize fat and oil consumption. So you add your, your egg. You can add some vegetables, because you want the raw fish. Now, you want to take something that will sustain you throughout the day, something that will be releasing sugar gradually. So if you take a drainage, a gutter that has rubbish in it, water is not able to flow through freely. But once the rubbish is cleared, you see the speed with which water passes through or flows through. It's the same way. So if you take food that is highly refined, like our Hausa cocoa, the one that we usually take, they sieve it and take out the chaff. So now it is easy for it to convert to sugar. So you take it, and the first few hours, it is already converted to sugar. The body is finished utilizing it, or it is converted into glycogen. You are feeling hungry again. You want something that has the roughage. If the roughage is in there, the rate at which it converts to sugar is gradual. So it can carry you throughout the day. Even if you are doing highly intense activity, you will still be fine. So you can take oats, you can take wheat. So all these foods that are high in fiber, you can take them. You can take rice. If you want to take rice for sahur, make sure that you add a lot of vegetables. And the vegetables, not necessarily going to buy cucumber, carrot, and all of. No, our tomatoes, vegetables. We even have some moringa. Some people are able to eat it. Chop it nicely, add tomatoes, add onions, and it will be nice. Add it to your rice, and you will enjoy it. If it is soupy food, some people, they don't mind anything they can have in the morning, even teased. Make sure that the portion, you have like a fist or 1.5 of your fist size. The soup is a lot. The soup can be ayoyo, the soup can be okro, the soup can be shure, and all of it. You can use it. So there should be some vegetables, some leaves in it. Now, in terms of protein, it is better for you to go for fish than to go for meat, especially for our elderly folks. It is healthier that way. And also omega-3, omega-6, they are in there to help. So this is, in brief, what I would say. So any food that you eat, just make sure that you have vegetables in it, you have protein in it. It is quite balanced. It is not only water, there is no milk and some bread, and you have it, and no, that is not enough. And if you can take wheat bread, all for the better. If you can add vegetables, like I said, anything that is leafy, you can add it to it, and you'll be fine. In terms of our iftar, like I said, let me add it to somebody who said I only dwelled on fasting. I didn't talk much about the feasting. The feasting I meant this evening, just go around and see how people are preparing to break their fast. One person, a table like this, all different food with different colors. You see kose, masa, cocoa, what. And they will eat all of it.
That is feasting.
Yeah, that is feasting. And they will do it throughout the period. So at the end, there is no way you will lose weight. You are going to gain weight. And a lot of people, they do that. And they bring meat. They fried meat, they will roast the meat. They will overindulge. Every day is feasting. That is what I'm saying. This period is not for it. Feasting is supposed to be one-off thing. On the day of celebration, on Eid al-Adha, Eid al-Fitr, fine, we can do it. But it shouldn't be habitual. It shouldn't be every day. So, and the Prophet ﷺ admonished us to use dates in breaking our fast. And even scientifically, the sugar that is in date, it is easy to absorb. And immediately you break your fast. Imagine you are going to perform some activity. You are going to pray. That involves some level of physical activity. You need energy. So when you break your fast with dates, it gives you that instant energy. Date is high in what we call potassium. Our activity involves stretching and bending and all that. Potassium is very important for muscular activity, for the function of the muscles. So date is the best. Usually I say date will try to make sure that there is normalcy. The body, nothing affects it. So if some people, when they take warm water, they become more active. Even sometimes I do that. I take some tea. Once I have some tea and all that to be able to perform my solar spiritual activity exercises before I now look for food. So Imam, if there is no problem, when you break your fast, make sure you have the fruit. And the fruit, not only date, only that it has that spiritual significance. When you break your fast with date, you can have watermelon, we have bananas and all of that. We can even have fruit salad. You know, it's not only vegetable that we prepare salad with. Usually in the traffic, they chop the different fruits together. That is fruit salad. You can have it. So all of it, because the fruit have different nutrients that they are rich in. You will benefit from all of it. So that is how you break your fast. And then when you start it slowly, you go and pray and come back, then you can now take your time and eat. And like I said, when you are eating also in moderation, and make sure that your food is balanced and not fatty, not salty, and not sugary. That you will be fine. So some people, when they are breaking their fast, different colors of drinks, you can't even tell where they are coming from. All sugar-based, it will not help you. Let's avoid that. You get water, tea, and fruits, and you are good to go. If you are invited to an iftar, when you go, if it is a buffet, start with the fruits. Make sure that you fill yourself with the fruit. By the time you want to eat the energy-dense food, you are full. That is how you help yourself. And then chilled or water, so whether you want to take it cold or warm, there is no problem with that as far as the system is concerned. Eating and blood group. In fact, for us as professionals, that is why you won't see any dietitian or nutritionist telling you that don't eat this because you are group this. No, it has not gotten there. Science is now building on it. Evidence on blood group and diet. We have not gotten there to the extent that we can use it to advise. We are dealing with life until we are sure, and it is not yet that certain. So it is still under research. So for now, we don't advise. So if you come and tell me I ate this and I feel fine, I say, okay, no problem. Go ahead, since it is good for you. But I will not advise you. But if you are also going to say, because you are blood group A, you are not going to eat vegetables and all that, I would say that one, please. Especially if you have condition that this is what will help you and you want to avoid that, I will tell you what it is and then you can help yourself. Kidney disease is common because of transition in our diet. Now we are eating a lot of protein, a lot of meat. Every corner, we are buying meat. That is a problem, and we eat more than we need. So somebody asks the kayas and all that. It is not food. What I said, the matchbox size, it's not food. It's meat. Meat is what I'm referring to. So the quantity of meat that you need in a day, about 6/8 of matchbox size in a day is okay for you. So that is what I mean. And you don't have to eat it at once. You have to make sure that breakfast, you have some, lunch, you have some of it, and then supper, you have some of it. Once you do that, I think you'll be fine. And I think that those are all the questions, right?
That's it.
All right. Thank you very much.
HAFIZ TV, unique every day.